is Preet Sandhu, and I'm a pediatric radiologist at Lebanon Children's Hospital in Memphis, Tennessee. Today, we will be discussing a case of lying down adrenal gland. A newly born male infant was referred to our hospital for renal ultrasound. He had history of abnormal prenatal ultrasound. Longitudinal grayscale ultrasound image of the right renal fossa shows an elongated right adrenal gland, also called the lying down adrenal gland. Despite multiple efforts, right kidney was not seen in the right renal fossa or elsewhere in the abdomen. Longitudinal grayscale ultrasound image of the left renal fossa shows a normally located left kidney. Mild dilatation of the central calyces of the left kidney is shown, consistent with urinary tract dilatation category P1. Final diagnosis is right renal agenesis. Ultrasound images show an elongated appearance of the right adrenal gland with alternating hypoechoic and hyperechoic bands, which is also called the lying down adrenal sign. This elongated appearance of the adrenal gland occurs as a result of absence of normal pressure from the kidney, suggesting absence of the kidney from its normal location. When elongated or lying down appearance of the adrenal gland is seen, diagnosis of renal ectopia or renal agenesis should be considered. A thorough search should be performed to identify an ectopically located kidney. If an ectopic kidney is not identified, diagnosis of renal agenesis is made. Differential diagnoses include horseshoe kidney and renal ectopia. Horseshoe kidney is the most common renal anomaly and is characterized by fusion of the inferior poles of the kidneys by a midline isthmus. No midline isthmus is seen in the index case, excluding the diagnosis of horseshoe kidney. Renal ectopia occurs as a result of failure of normal ascent of the kidney from pelvis to its normal location in the renal fossa. Renal ectopia can be simple, where the kidney is located ectopically but is on the same side. When the kidney crosses to the opposite side, it is called crossed renal ectopia. In such cases, both kidneys are located on the same side of the abdomen. In the index case, right kidney was not identified anywhere in the abdomen or pelvis, excluding the diagnosis of renal ectopia. Normal adrenal gland has an inverted V or Y configuration, which occurs as a result of pressure from the normal kidney. In case of absence of a normally located kidney, as in renal ectopia or renal agenesis, adrenal gland is seen as an elongated structure, also called the lying down adrenal gland. Thorough search should be made to identify an ectopically located kidney before making the diagnosis of renal agenesis. Renal agenesis can be associated with anomalies of the cardiovascular, gastrointestinal, skeletal, and genital systems. Genital anomalies are usually ipsilateral to the side of renal anomaly and include unicornuate or bicornuate uterus and imperforate vagina in females. In males, absence of seminal vesicles or vas deferens, seminal vesicle or epididymal cysts, and undescended testicles may be present. I hope you enjoyed this presentation, and thanks for listening.